We are going to talk about 4 things. 1. Gastroesophageal reflux disease. 2. Irritable bowel syndrome. 3. Inflammatory bowel disease. And 4. Constipation. Let's explore in brief some ways to improve and manage common gastrointestinal disorders before we go into details. The gut microbiome refers to the diverse community of microorganisms, bacteria, viruses, and fungi, residing in your intestines. Having a variety of beneficial bacteria is crucial for health. Research suggests that a higher diversity of gut bacteria is associated with improved mental and physical health. Signs of an unhealthy gut. Pay attention to these common signs of an unhealthy gut. Upset stomach. Symptoms like gas, bloating, constipation, diarrhea, and heartburn may indicate gut issues. High sugar diet. Consuming too much processed food and added sugars can reduce good bacteria diversity and lead to inflammation. Unintentional weight changes. Weight gain or loss without dietary changes could be related to gut imbalances. Lifestyle and dietary tips. Probiotics. Incorporate probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi into your diet. It is easy and cheap to make kimchi and sauerkraut at home. Fermented foods. These promote gut health by providing beneficial bacteria. Both sauerkraut and kimchi are fermented foods. Stay hydrated. Proper hydration supports digestion and prevents constipation. Check and count how much you drink each day. It should be around 2 liters or half a gallon. Prebiotics. Consume foods rich in prebiotic fibers to nourish gut bacteria. Avoid processed and sugary foods. These can negatively impact gut health. Stress management. Chronic stress affects gut function, so practice relaxation techniques like deep breathing and meditation. Common gastrointestinal disorders. Gastroesophageal reflux disease, GERD, acid reflux causing heartburn and chest pain. Lifestyle changes and medications help manage it. Gallstones, hard deposits in the gallbladder that can cause upper right abdominal pain. Surgery may be necessary. Celiac disease and gluten intolerance, an immune reaction to gluten, damaging the small intestines villi. A gluten-free diet is essential. Irritable bowel syndrome, IBS, functional disorder with symptoms like abdominal pain, bloating, and altered bowel habits. Ulcerative colitis, an inflammatory bowel disease affecting the colon and rectum, with symptoms similar to Crohn's disease. Managing common gastrointestinal disorders improvement involves a combination of lifestyle changes, dietary adjustments, medication, and, in some cases, surgical intervention. Below is a comprehensive guide on how to manage and improve symptoms of some of the most common GI disorders, including irritable bowel syndrome, IBS, gastroesophageal reflux disease, GERD, constipation, and inflammatory bowel disease, IBD. This information is for general guidance. Always consult a healthcare professional for personalized advice. Number 1. Irritable bowel syndrome, IBS. IBS is a common GI disorder characterized by abdominal pain, bloating, and changes in bowel habits, diarrhea, constipation, or both. Lifestyle changes. Stress management. Stress can trigger or exacerbate IBS symptoms. Consider relaxation techniques like mindfulness, meditation, or yoga. Regular exercise. Physical activity helps regulate bowel movements and reduces stress. Dietary adjustments. FODMAP diet. A low FODMAP diet, which limits certain carbohydrates, can reduce IBS symptoms in some people. Fiber. Balance fiber intake to prevent constipation without causing excessive bloating. Hydration. Drink plenty of water to help maintain regular bowel movements. That is about 2 liters of water or about half a gallon. Disclaimer. Consult your healthcare professional before making any changes to your medication or lifestyle. Medications. Antispasmodics, to relieve abdominal cramping. Laxatives or anti-diarrheal agents, depending on the symptoms. Probiotics, may help balance gut flora. Number 2. Gastroesophageal reflux disease, GERD. GERD is characterized by frequent heartburn, acid reflux, and other symptoms caused by stomach acid flowing back into the esophagus. Lifestyle changes. Weight management. If overweight, losing weight can reduce pressure on the stomach. Elevate head while sleeping. This can help prevent nighttime reflux. Avoid smoking and alcohol. Both can exacerbate GERD symptoms. Dietary adjustments. Avoid trigger foods. Common triggers include spicy foods, caffeine, chocolate, and fatty foods. For example, stop caffeine and see whether that helps. Focus on a balanced diet rich in fiber. This includes fruits, vegetables, whole grains, and legumes. Probiotic foods like yogurt and kefir can also be beneficial according to clevelandclinic.org. Limit processed and packaged foods, unhealthy fats, and sugary or sweetened drinks, as these can irritate your digestive system. Smaller meals. Eating smaller, more frequent meals may reduce reflux. Timing of meals. Avoid eating 2-3 hours before lying down. Also practice taking meals at the regular times. If you are going to miss a meal due to an official engagement or meeting, at least drink a glass of water during the scheduled meal time. Medications. Antacids, for immediate relief of heartburn. H2 blockers or proton pump inhibitors, PPIs, for longer-term acid suppression. Number 3. Constipation. Constipation involves infrequent or difficult bowel movements. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Lifestyle changes. Regular exercise helps stimulate intestinal motility. Establish a routine. Aim for regular bowel movements by setting aside time each day. Dietary adjustments. Increase fiber intake. Include more fruits, vegetables, and whole grains. Hydration. Drink plenty of water to soften stools. Medications. Stool softeners or laxatives. Use with caution and under medical supervision. Fiber supplements can help increase dietary fiber. Number 4. Inflammatory bowel disease, IBD. IBD encompasses conditions like Crohn's disease and ulcerative colitis, which involve chronic inflammation of the GI tract. Lifestyle changes. Stress reduction. Reducing stress can help manage flare-ups. Regular exercise contributes to overall well-being. Dietary adjustments. Identify trigger foods. Some foods may trigger inflammation or discomfort. Balanced diet. Focus on nutrient-rich foods to support overall health. Low residue diet. During flare-ups, a low-fiber diet may help. Medications. Anti-inflammatory drugs, such as aminosalicylates and corticosteroids. Immunomodulators or biologics, for more severe cases. Antibiotics, in some cases, to manage infections. Surgical intervention. In severe cases or when complications arise, surgery may be necessary to remove affected portions of the GI tract. Do not forget to click the like button and subscribe. Up above you see a video related to health. Thanks very much for watching this video. Subscribe to my channel.